want to talk a little bit about my surgical experiences and how, even though I'm a doctor, the doctors don't really understand. I'm like, almost the best thing about being a patient as a doctor is that it teaches you to understand the patients. Because I don't care how many patients you've had with these problems, you don't really understand it until you've gone through it yourself. I'm sorry, but that's just the reality. And, anyway, so it has taught me a lot about being a little more understanding with my patients. Because sorry, the doctors just don't understand unless they went through it themselves. Okay, so went and got the surgery, and I did a lot of prep ahead of time. You have to do all this stuff of washing yourself with these antiseptics to reduce the risk, because I was terrified. I'm not talking about my shoulder surgery, but unfortunately, another bike accident. I had shoulder surgery, and after my surgery, I had a post-surgical infection, and it was horrible. I had to go through 3 surgeries. So I was terrified of that. I said, what can I do to reduce my risk of infection? And they gave me all these things I can do, one of which was you take a shower with an antiseptic. You rub yourself in the, so I did all that stuff. I'm like, I'm gonna do every single thing I possibly can to reduce my risk. And anyway, so I did all that. Then I had the surgery. I went to the surgery center down the road from Christiana Hospital. It's part of First Aid Orthopedics. I would have to say they were, not trying to do any commercials for any practices, but they were fantastic. You really do not need to be in a hospital for this. Those guys really knew what they were doing, unless you have medical complications. They were really good. Went through the surgery, woke up, and they started asking me. They said, "Can you feel your feet yet?" And I was like, I don't think, no, not really. And they're like, all right, I'll come back to you in 15 minutes. All right. I'm like, all right, I'm half groggy and whatnot. And then they say, because you're still, they're giving you anesthesia at the time. So I'm having no pain at the time, right? And they also give what they call a regional block. So you really can't feel your hip, but you can feel down, you can start to feel your leg down further. All right. So, so then they come back in 15 minutes. Can you feel your feet yet? I'm like, yeah. Okay. Wiggle your toes. I'm like, I wiggle my toes. All right, here we go. And they're like, all right, come on over here. We're going to start your rehab. And I was like, they had told me that before, but I was like, what? You want me to start walking? And they're telling me what they're going to do. Okay, walk. That's fine. And they're saying, and then we're going to do this, this, and this. And then we're going to have you walk up steps. And I was like, you've got to be kidding me. How can you walk up steps? I just had surgery 2 hours ago. And they're like, no. You can do it. You can probably do it. So they had me doing stuff. They had me move your leg around, push against their hand, trying to extend my hip. I'm like, okay. And they're like, come on over here and walk up the steps with the walker. Right? No, right. No, they said, actually, go without the walker. Once you get to the top, you get the walker back. I was like, but I did it. And again, my hip wasn't hurting yet because the block was still on board. Right. So that's an important thing to remember. When you come out and you say, you're right, I can do that. It doesn't really hurt. That block is going to wear off. And you got to know that ahead of time. And you got to plan for how you're going to take your medication for when that block's going to wear off. Because if that block wears off and you got no medications on board, you're going to be screaming, right? So anyway, I knew that again helped a little bit about being a doctor. I knew how long it was going to take to get the oxycodone on board, so I knew an idea, but I know exactly when the block was going to wear off, right? So the block took about 24 hours to wear off, but I took oxycodone ahead of time. That's one thing I got to say. I know one of the things is doctors are like terrified of opiates these days. They're like, nope, we can't give them to you. I know doctors who say, I don't prescribe them, right? Okay, I know there's a lot of laws around it and stuff. But to me, it's like, I don't know, as a doctor, you need to be able to prescribe these when they're appropriate. That's what I think. But okay, if someone doesn't want to do it, fine. But because there are times when you need these things. Chronic pain, sometimes, I mean, they're not as good for chronic pain, but certainly for acute pain, oh baby, you need these things. And to just say I'm going to tough it out without it, man, I don't know how somebody can do that. I can't do that, right? So anyway, so I got my oxycodone on board, and because about when I thought to comfort when the block was going to wear off, and I took one dose when it probably went in me and went out of me before the block wore off. I probably didn't need it. I'm going to say to people, take it anyway, right? Don't be afraid of it. I mean, okay, I know some people, I have some family members and friends who have a history of opioid addiction. Okay, fine. I don't want to ever say to someone, if you really think you can't take it, or you got to be, okay, fine. But someone who doesn't have that, I would say, take it. If you take one and you really didn't need it because your block didn't wear off, don't worry about it. To me, that's what I would say. So then I'm taking the oxycodone along with the other things. They got you on gabapentin, and they got you on other meds too. So I'm taking all those things. But I want to tell you, when that block wore off, I knew that block was wearing off. The block, when I say block, I keep saying block. It's the thing where they give you like an anesthetic, almost like what an anesthesiologist does, so that the nerve sensation is blocked, so you can't feel any pain there, right? So when it wears off, you're going to feel pain there. So all you have is your pain medicines like your oxycodone, your gabapentin, and all that to help you out. I'm going to tell you, when I felt that block, when that block was wearing off, you are feeling that block wearing off, right? And this is the part I'm going to say, I think the doctor was a great doc. He's a great guy. But I think the doctor, or maybe the PA who saw me, could have done a little bit better job at preparing me for what you're going to feel. You were having pain. You were having a lot of pain. I'm like, take those medications. You think you're having more pain than you should, or you're having more pain than your medications can handle. You need to go see the doctors. And when you call them and they say, oh, we can't see you, we don't have any availability for 3 days, you say, no, not okay. Right. And if you can't get the surgeon to do it, call your primary care and ask them to help you. They're not really supposed to give you pain medicines post-surgery, but they can help you get into your surgeon, right? Because they need to see. If they hadn't seen me, right, I wouldn't have known what was going on, and they wouldn't have been able to give me the extra meds. So I got through it. It took longer than I thought. I had a lot more couldn't sleep than I thought. It was for a couple of weeks. I couldn't sleep very well at all, which is not good for your health.
Even with the pain medicine?
Even with the pain medicine, yeah. Yeah, even with the pain medicine. Now, again, could I have taken more pain medicine? Maybe. I'm going to tell you, they were very reluctant to give me higher doses. They kept wanting to give me more and more gabapentin. And, I forget I don't think they did give me a higher dose of oxycodone. I think they gave me a little, like a longer course.
Okay.
And again, if you need more, you need more. The only person who knows your level of pain that you're having is you. And
But that's easier said than done, Dr. Gill, because a lot of doctors, like you said previously, won't do that. They won't increase it.
I know. I know. It's so obviously you can't force them, but you can. I don't want to use this word because it sounds like you're being whiny, but you can bug them. You go in,
Right.
you say, if they won't give you more, you say, well, okay, at least give me the same dose to continue. Like, don't let me run out. No way. Okay. And if they say, hey, let me give you more gabapentin, you say, look, you need to try something. So if they say, let me give you higher gabapentin, let me add a muscle relaxer, let me give you an anti-inflammatory, stronger anti-inflammatory. I don't want to give you more oxycodone, right? But okay, fine. Then you say, yes, but if it's not working, I'm coming back tomorrow. Right? Like, not coming back in 3 weeks. I'm coming back tomorrow, maybe 2 days at the most. You got to push these docs, right? Because their default is always like, yeah, here you go, and see me in a month if you're lucky, right?
Right.
So even you can't force them to give you a medicine that they don't want to prescribe, but you can tell them, and you can say, look, then if you're not gonna give me more of that, you need to give me something else. And if it's not working, I'm coming back. And your staff needs to say yes when I call and say I need to come back. And like I said, if you can't get them to do it, they need to. That is their job, right? They have PAs and they have all these people who are there. You know, the surgeon, oh, sorry, the surgeon's in OR all day. That's what the PAs are for, right? Or nurse back. Usually they have physician assistants working with them, and they can do all of this stuff, right? So that's really important. I will tell you, you know, I got, you know, I went through a rough time, but it got better. Finally, that thing with it was that muscle, it was that quadricep muscle that they just pulled the heck out of. Like they pulled it in directions that wasn't supposed to be pulled, you know, and that hurts. You know, what do you, I don't know, it just hurts. But I will tell you, I'm still happy I got that approach, because now my hip is like, I feel like $1,000,000 with that hip. I'm playing
Awesome.
tennis, I'm dancing my butt off. I'm going tonight to go dancing.
But as far as the story is, just shine your light, share your journey. When you are courageous, you create a spark that ignites and inspires others to be brave. You know, that was good what, Dr. Gill did, talking about it, because I saw a lot of the things and experienced all of the things that he had and the journey to heal back again. So
Right.
having the pain and feeling that, bone crunching pain,
Right.
he'd be a good person to speak on. Doctors and nurses, they should listen to, you know, sickle cell patients, let's say. And there are others out there. And we know there are others that are doing it for the wrong reason. But pertaining to us, we need to break down that wall that doctors have, that we want opioids and we're just drug addicts. No, try and feel our pain for a day and you'll see, what it's all about. But we thank God that we're here and everything. Thanks everybody for
Right.
being on the call, you know.
Yes.
And
And
also too, Derek, I'm gonna say to everybody, because we won't talk to each other again, have a happy Thanksgiving.